Well, welcome back to the channel. My name is Dan, pharmacist and owner here at MD Custom RX. And last week we had a seminar on sleep and how to achieve that. We certainly went through some sleep hygiene material. So in the material that you'll see in a few moments, we go through just some basic steps on how to get into those deep sleep cycles. I'm just going to briefly go through some of the products that I like to use here at the pharmacy. If you haven't tried reacted magnesium for sleep, I highly recommend that. Other go-to products that I like, certainly the Botanicalm PM by Orthomolecular. And then the other product that I talk about in tonight's seminar is the Serenity PM. And that's a good catch-all. It helps with both falling asleep and staying asleep. If you call the pharmacy, I can certainly set up a specific program for you. The other thing that we talk about in the sleep seminar that you'll see in again a few moments is ZRT has a what's called a sleep balance profile. Hopefully you can see that. And essentially what that measures is your melatonin and cortisol levels. So it's a unique way to do a urine sample that you collect in the morning. You can actually see what's going on through metabolites, what your melatonin and cortisol is doing throughout those sleeping hours. So hope you like the presentation, and if there are any questions, certainly give us a call at the pharmacy. The number here is 262-373-1050. Our pharmacy hours are Monday through Friday, 9:30 till 6. Thank you. All right, so let's get into this. First things first, though. So I'm not a medical doctor. I can't tell you to stop your Ambien or some other prescription sleep aid tonight and say take some melatonin. I can make suggestions and recommendations, of course. But again, I can't. If I didn't, the general rule is right. Well, I'm not a doctor anyways. But even if I was, I'm not going to stop a medication if I didn't start it. I would say go back to your provider that started you on, if you're on a prescription sleep aid, and work with him or her to, taper off of that. If the doctor at that point is open for suggestions from me, I'm more than happy to do that. I've done that with multiple patients on lorazepam, antidepressants that are often used for sleep, and Cymbalta, gabapentin. I've seen a lot of other drugs that are not FDA approved for sleep aids used to help with sleep, so I've definitely been involved in that. So if you need help in that regard, certainly let me know, and I can help assist as long as the doctor's willing to work with us on that. So that's what all of that says. Just a real brief overview of what we're going to try to cover tonight. So again, some of these things are real basic. What are the health benefits of sleep? We all should obviously know that. And then what are the health consequences of not getting enough sleep? Again, there's quite a few non-pharmacological things we can certainly do to achieve better sleep cycles. So we're going to go through that, of course. Like I said, I don't want to leave with, CBD oil for sleep and the melatonin and GABA and theanine. We'll touch on all of those. But if we can do this naturally, that would be, without any intervention other than just some lifestyle modifications, that's what I'd like to do. We're certainly going to get into melatonin and cortisol. The lab that we use here is ZRT Lab. We've been using them for 20 years. Dr. David Zava, I've met him on numerous occasions. He is the owner, the director of the lab out in Oregon, in Beaverton, Oregon, that we've been using. And they have a great test to measure a patient's melatonin levels and cortisol levels actually throughout the night. They actually do a urine collection test, and they can actually go back and extrapolate from your metabolites in your morning urine to see what you were doing the previous 8 to 10 hours. How much melatonin did you make? How much cortisol did you make? And then from there, see if there's actually an issue with that. Because if there is, then there's an easy solution to that too. If it's not that, then great, we ruled that out and let's go down another path. But
do you have that test here, or does it need a doctor's?
We have it here. You could just, the nice thing about it in Wisconsin, you don't have to have a doctor's order to get it, so you can just purchase it tonight if you wanted to. So that's a simple thing to do. Yep, I don't know the cost off the top of my head. We can look at that. It's written down. So, and then of course at the end we're going to just review my favorite supplements that I like to implement if we've done all the other things and the bed's nice, the room's dark, all that kind of stuff. Okay, let's pull out some supplements and see if that can move the needle in the right direction. Again, this is nothing earth-shattering. We know there's a lot of people out there that suffer with insomnia, sleep issues. We got over 60 million sufferers in the U.S. More than half of those people are using caffeine to offset their poor night's sleep. I mean, look at all the Starbucks and coffee shops and so forth that are out there. Even myself is prone to that. I'm going to drink some coffee actually throughout this seminar. Shame on me.
You have 4 friends.
I do what I say, not what I do. I had a long day already. Yeah. I am very transparent on it. Millions of sleep aids out there. I mean, even in my, speaking of honesty, in my medicine cabinet, I've got, the Tylenol PM, Advil PM, Benadryl, so on and so forth. We'll get into a few of those tonight.
Can I hop in with
Yeah, sure.
about that?
Huge connection between hormone disruption and sleep quality. So we see that obviously with majority of what we dispense here, over 50% of it is bioidentical hormones. And a lot of women, especially women, unfortunately, well, men too, but they're deficient in progesterone, and progesterone is a great sleep aid as long as it's taken in the oral form. We do a lot of progesterone topically. I will tell you that does not really help with sleep at all. You've got to, if you're doing progesterone as a cream and you still have crummy sleep, one suggestion is to, again, this is through your doctor, of course, but take that cream dose, roughly cut it in half or somewhere in that amount, and take that half that was on a cream and put that into a capsule and swallow that at night, because that will actually help stimulate your GABA receptors and help calm you down at night. But the progesterone's got to be in the oral form, in a capsule form. So that's one little trick.
Excuse me.
Yep.
My doctor did that.
It did.
20 milligrams of progesterone.
Didn't help. And it's, yeah.
Like for 2 nights,
Yeah.
and I was right
Back to it. And that's, and it's right. It just, what I'm going to recommend, and nothing's going to work for everyone the same, but it's one of those things to certainly try. Because on the flip side, I've seen some women that come back over the weekend and be like, why didn't I get progesterone 20 years ago? So as long as you've tried it, great. It didn't work. Okay, let's move on to the next thing. But it is something, if you haven't tried, I highly recommend it for sure. So. These are all things we already know. Why do we sleep? It helps with memory. Again, Dr. Whitcomb has a great seminar on Alzheimer's and Alzheimer's and memory loss, on how when we sleep, our lymphatic tissue basically opens up and flushes all the metabolic debris out of our body, and that helps with consolidating memories, learning, so on and so forth. It's all that tissue repair, cellular repair that's happening at night. If we're not getting that, good luck trying to put memory and learning together. Restoring cells, tissues, improves muscle growth, fat loss. So again, if a patient isn't sleeping well at night, good luck trying to get them to lose weight efficiently. They can still lose weight, but it's going to be a lot harder to do that. Because again, when our bodies are asleep, there's all other systems in our body have different circadian rhythms, different biological clocks within them. They're running on different cycles. Our mind's asleep and our body's sleeping, but there's other organs and tissues that are awake and functioning during the night that are doing a lot of work. Production time for hormone synthesis. So if you can get a patient to sleep better, their hormones are going to naturally balance out. Maybe not to the full improvement where you don't need any hormone therapy, but it's certainly going to help. So when you look at adrenal fatigue and hormone production, if you can get a patient even just to sleep better, their thyroid's going to work better, their cortisol's going to work better, their sex hormones are going to be better balanced. So that's important for that aspect too. So again, we can make all the hormone creams and capsules, as we do every day. I dispense hundreds of them every single day. But if you can get that patient to sleep better, you can pull back on all of those hormones that they might be taking, or some of them to some degree. And then I just alluded to Dr. Whitcomb's seminar on just I call it the metabolic flushing at the end of the day while we're sleeping. It helps to detoxify the body. The lymphatic system is activated during the night. And so that's just cleaning up all of the cellular debris that our body is trying to flush out and get rid of. So, and again, if we're not sleeping, that system's not activated. And I'll kind of correlate some of those things back to some of these conditions that we see just with insomnia. We may not make that correlation, but it's there. Benefits of a good night's sleep, I'm sure we could come up with this list on our own, but increased energy, improved concentration, better capacity for learning, increased ability to make healthier food choices. I mean, I fall prey to that when I don't get a good night's sleep and I'm trying to run throughout the day here. I'm not grabbing the best food to get me energy. Reducing the risk of chronic disease such as type 2 diabetes. So that again, if you think of that patient that has insomnia or sleep apnea and their lymphatic system isn't being activated and they're not detoxifying well enough, good luck of getting that patient to lose weight efficiently, and good luck trying to help manage glucose properly. They're going to be more prone and they're going to have an increased risk of type 2 diabetes. So that correlation's already been studied and shown. Better memory, increased life expectancy, that sounds like a good one. Reducing the risk of being overweight, just talked about that. Reduced stress levels. So there's kind of a fine balance between having enough cortisol in our body and getting us through the day, because we don't want to demonize cortisol. We need cortisol to survive, but we don't want too much of it either. And so if we get a good night's sleep, our adrenal glands can better respond to stress. And when we get into that stressful situation, we're not going to have that, potentially we're going to lower that risk of overproducing cortisol during that stressful response time. And then reducing the risk of developing Alzheimer's or memory loss, essentially. So here's one of my kiddos, and I can't even tell you who this is anymore. I think this is Luke. He's 5 now, so.
You could tell us anything.
Yeah, I know, right? You wouldn't know, yeah.
Exactly.
Yeah. So we need biological downtime. We all know that, right? Sleep is just as essential as food for survival. If we don't sleep, we are not going to survive. We all know that. Sleep heals. Immune reserves are replenished during the time of sleep. Part of that has to do with the detox process. So again, and we all kind of intuitively know this, if we're not sleeping well, we're more prone to being sick. Plain and simple. So we need sleep to help the immune system recover. Sleep makes us, or helps us to burn fat. Makes us smarter. That's because our brain is flushing all of this metabolic waste out of our brain and replenishing it and helping it with oxygenation and so forth. Sleep restores. It kind of puts us on reboot. So we want to make sure that mentally we're in that right place where when we go to sleep, we are going to leave today alone and leave that, and then go to sleep and then start a new day. We're not going to carry all of that with us the next day. So that's why I kind of think of the sleep reboot cycle. We don't want to keep worrying about yesterday and so forth. We want that start over time. I threw a few myths in here that just drive me crazy. Like the older I get, the less sleep I need, and that's certainly not true. We still have the same amount of cells that we do today, 10 years from now, so on and so forth. All of those cells need to be repaired and so forth. So you need just as much sleep now, or 10 years from now, or 20 years from now. So don't buy into the fact that, I just need 4 hours of sleep or 5 hours of sleep versus 6, 7, or 8 hours of sleep. Everyone kind of has in their own mind what would be a good night's sleep for themselves. In my mind, it's 7 hours for me. But it's one of those things. I don't want you to start thinking that, if I get just 5 hours of sleep, I'm fine. And here's all the consequences of lack of sleep. So again, this has all been, I could pull out all the research from my office and the studies upon studies that are showing this. 4 out of 5 sufferers from depression are sleep deprived prior to diagnosis. We know with depression, there's again multitude of different reasons, but one of those reasons is a lack of serotonin. Serotonin is actually derived from melatonin. There's a connection there. So that to me is like, I wasn't terribly surprised when I'm reading that study and reading that information. We talked about this already, but if you're not sleeping well, higher risk for diabetes, obesity, overeating, eating the wrong type of food, premature aging. I touched on that. You just don't get that cellular repair during the night if you're not sleeping well. You get into that deep sleep, and we'll get into that. Premature aging, susceptibility of infections, just touched on that. Stress and just cortisol. We'll look at cortisol levels in a minute too. But the adrenal glands are best repaired between 7 to 9 o'clock in the morning. So if you can get yourself to get into the deep sleep cycle, 7 to 8, 9 o'clock in the morning, which most people are up by then, right? Like who sleeps past 7 o'clock? Yeah, okay, it's good, all right, good. All right. Ideally, you want to do that if you can, right? Or maybe, and I always try to play the game, okay, if I have to get up at 6 o'clock every morning, then I want you to get to bed earlier and see if you can get yourself in. I mean, you can get a Fitbit watch for a cheap one at Kohl's for probably $10 now. And so I just encourage you to do that if you're really struggling. See what your sleeps, are you actually getting into those deep modes of sleep, because that's important. If you're not, then there's some work that we need to do and start looking at some things that are going on in the middle of the night. Maybe you have too much cortisol spiking. Maybe you don't have enough melatonin. I mean, then we kind of go down that checklist and figure out what that is. So, 65, I think this number is, so the Better Sleep Council estimates that 65% of U.S. adults are losing sleep due to stress. Now, that statement was taken before COVID-19. This is obviously not all inclusive, but menopause. That's again, that I relate a lot of that to that progesterone dropping, or even I would even argue patients that are. I'm jumping around a little bit. I apologize, but I have a slide coming up that talks about birth control can really muck up sleep. You know, and you got all these young women that are on birth control, and then they go to the doctor and they give them an antidepressant instead, you know, or benzodiazepine or something else. It drives me nuts. Obesity or even sleep apnea, that kind of sometimes goes hand in hand. Shift work, stimulants, blue light, that drives me crazy. Either put your blue light filter on your smartphone. I have that on my phone all the time. Just don't use your phone. I usually say at least 2 hours prior to when you want to go to bed. I'd even say earlier if you're really struggling. Unlike my wife, she's sitting there and using her phone until she falls asleep with her hand in her phone. So you got that side of it too. So, here's medication that can cause sleep disruption. And again, this isn't all inclusive either. Thyroid medication. Thyroid medication, I see that, and we do a ton of thyroid here. I would say 70% of the patients that walk through our doors are on some type of thyroid medication. And that's not always, I mean, most times when you're in pharmacy school, the pharmacist is taught, the pharmacy student is taught to tell your patients to take their thyroid medication in the morning. Some patients will actually do better taking their medication at night, which again, it seems really strange, right? I mean, this was brainwashed into my head during pharmacy school that, you know, take your medication in the morning. It's more of that circadian natural rhythm. They want that thyroid boost in the morning. T3 is a stimulant, or even T4, or like your basic synthroid, levothyroxine. That's going to convert into T3 and cause that patient to have insomnia. Maybe not all the time. So there are some patients that actually do better when they take their thyroid right at night, right when they go to bed. Because again, the general rule of taking it on an empty stomach, it interacts with calcium and minerals. You want to take it first thing in the morning. But there's a small subset of patients that actually do better taking it right at bedtime. So.
Does it matter if it's the Armour thyroid versus?
Nope. Armour, yep. All thyroid medicines. So. Again, I'm not telling you to go home tonight and start taking your thyroid tonight, but consider, you know, I'm just giving you options here. Just consider. Talked about the oral contraceptives. Those are just sleep disruptors in general, no matter what time of day a patient might be taking them. Beta blockers, again, that could be any time of day. So there's some legal and illegal drugs on here. So marijuana, alcohol. Again, we all think of, I'm going to have a drink to help me relax. That's a double-edged sword. I mean, I'm not opposed to that at all times, but you got to be careful with that as well too. Don't let that be a crutch for masking something else. DHEA. So we do a lot of DHEA as a hormone here. It's actually sitting on our shelves back over there. You can buy it as an over-the-counter supplement. We compound it with a lot of the hormone creams, and there's a few doctors that will combine all of the hormones, your estrogen, your progesterone, your testosterone, your DHEA, and wrap it up all into one cream. And I'm going to tell you to typically to take it at night. And so now we've created a potential problem. And so if you are one of those patients where you're having that cream put on at night and then you've noticed your sleep has gotten worse, you might need to switch that cream to the morning. So, or if it's just the DHEA tablet that's over the counter, you want to take that in the morning. That can be a tricky thing. And again, there's more meds, but those are the ones that I mainly see here. So yeah, that is Luke. I can identify him. And this is Grace. And I don't know where we were at that time, but it's amazing how kids can just fall asleep anywhere. Cool temperature. So make sure the room is not really warmer than 70 degrees is the general rule of thumb. Dark room. I spent the whole weekend in Chicago learning about circadian rhythm. And I can't tell you enough that if you're in your bedroom and let's just say you have a window open and there is a street light or there's like, these lights across the parking lot, your eyes are closed, but that light is on over there, your pineal gland in the back of your brain is still picking that light up. We can measure it. And so you need to have that room completely dark. You want blackout shades. Isn't that crazy to think that? But that gland will pick that up. This is faintest amount of light. So we got blackout shades in our room because we didn't have shades on our window for the longest time. And it certainly helped having those blackout shades. So zero.
Put a blanket over your head.
You could do that. Yeah, or a sleep mask, then do that. But you don't want any light in that coming into that room or getting onto your eyelids. So even the, what am I trying to say? Your alarm clock. Put a blanket over that or whatever, a cover over it. No laptops, TVs, phones in the bedroom. I'm sure we all know that by now. No, if you need to use white noise or fans, I'm certainly a big fan of that because I suffer with tinnitus and my ears. If there's not some kind of sound going on in the room, my ears are just buzzing. So we have 2 fans going on in our bedroom, even in all our kids' rooms too. Find the right mattress and pillow, of course. All those comfort things. Those things I think we all know those. So I'm going to skip through that. This was in the middle of the day. Both fell asleep. I don't even know what we were doing that time. I just zonked out, and Lily's got her sunglasses on. I don't know. Who knows? It's hilarious. So extra help. So if you have sleep apnea, get that fixed. I have a handful of patients that we've identified that I said, you know what, we've tried everything else, and sure enough, they had sleep apnea. And they got the device, the breathing machine, and lo and behold, their sleep was amazing. They lose weight. So you got to make sure we're not looking over some of these potentially obvious things that could be disruptors. The TMJ issues, people grind their teeth at night. Get that fixed. One little trick. Yep.
What's the you're about to
Yeah, the riboflavin. Yeah, don't ask me how it works.
Huh.
It's been shown to work. TMJ, 100 milligrams. So it's a huge dose. I don't even know if I stock riboflavin just by itself, but we can get it. I know it's out there. We've ordered it before.
Is there a time of day issue with that?
No. Mm-mm. Yeah. But yeah, just an odd thing, right? Who would think vitamin B2 is that? B1 would be helpful for that. Restless leg syndrome, we see a lot of that. Yeah, I know. I raise my hand for that. Magnesium's helped me at night, and that's why I was doing my magnesium all the time at night. But that kind of backfired on me recently. Iron, the right kind of iron though. I do not want anyone to be on ferrous sulfate or ferrous gluconate. I hate those irons. They're constipating. They don't absorb well. They just, in my opinion, it's junk. I'd rather you get like a reacted iron or a chelated iron. There's so many food-based irons out there that are way better. If your iron is causing you constipation, that means you're not absorbing it. That means it's not working. Plain and simple. So.
And I remember Dr. Woodcomb talking about iron and Alzheimer's.
So there's a fine balance. You don't want to over-iron yourself. Iron is, in theory, toxic to a point. especially for men. We absorb iron, we don't bleed as much, right? And then, yeah, that's been correlated to higher heart disease, and yeah. But if your restless legs are not going away, try a little bit of iron, maybe an hour, or even take it with dinner and see how that goes, yeah. I'm still counting sheep. So I'll just read. So solving the insomnia riddle without taking into account hormones is like trying to get a good night's sleep with all the lights on in the room. It's just not going to work. So if you've tried all your sleep aids and you're still struggling and you've never had your hormones tested, we need to get your hormones tested. We need to know what your estrogen, your progesterone, your cortisol, your DHEA. We need to know what's going on internally with all of those messenger signals to get to the root cause of your sleep issue. So we'll get to that, I think, in the next couple slides. Here's another myth. Naps are a waste of time. If you need to take a nap, what's the magic number? If you Google, like, is it 22 minutes? I've done this before. Is it 27 minutes? There's all kinds of research on, like, what's the perfect amount of nap time. I'm not going to get into that tonight, but whatever feels right for you is my answer to that. Is it 12 minutes? I mean, there's all kinds of theories on how many minutes your nap should be. So hormone testing. I recommend testing if you've tried all these things. If you've cut out all of your caffeine, if you've tried the sleep aids, natural or prescription otherwise, and they haven't worked, and you still have that sleep, and you've crossed out the sleep apnea, or that you're not being bothered with TMJ, or something else going on. Let's look at your melatonin levels, and let's look at your cortisol levels. Those are my main two. Again, in addition to the sex hormones, I want to look at melatonin and cortisol levels in your body. So real quick on melatonin, this is just what you would get if you were to do that test from ZRT. This is what your report's going to come back and look. Well, this is an ideal situation. I've seen some come back and they're not so good. So, but your cortisol should have a natural rhythm throughout the night, which is actually really low. Honestly, it's like almost like a flat line. And then your melatonin is going to have a different curve to it as well too. So we want to look at that and see what's going on. So this, let me see if I got this right. So this is 12 o'clock noon right here. Ideally, though, your cortisol is peaking at about half an hour before you wake up in the morning, and then your cortisol should, as you go to bed, like here's 9 o'clock at night, this purple line, your cortisol should actually be 0 and almost flat line throughout the whole entire night. So this cortisol is pushed back a little bit later in the day for some reason on this patient. But now melatonin is interesting. When I was at that seminar in Chicago, we don't know if it's kind of the chicken or the egg. Does your body produce melatonin because it's sleeping, or does it sleep because there's melatonin? We don't really know the answer to that still. So, patients come in, and I would honestly say half of them, the melatonin works for them, and it causes them to sleep better, but then the other half, it doesn't do nothing. And they're asking me why, and I'm like, I don't know. It could be that melatonin's a byproduct of sleep, or maybe not. Still don't know. So that's, again, if we figured out that answer tonight, then we're all going to be rich. But I don't think we're going to figure that out. So again, if you tried melatonin and it didn't work, it's about a 50-50 shot. But I still want to see if your body's producing it. If your body's not producing enough melatonin, I'm going to want to give you more and see if it works. Again, it'd be a trial and error. It's cheap. For $20 you can get enough melatonin that'll last you 2-3 months. Let's try it, but it's something we might want to look at. So melatonin has been used in COVID. I don't know if anyone's know that, but actually melatonin at 20 milligrams can be very helpful at reducing the virus from spreading in the body if you're infected. It wouldn't be like my first choice to reduce the viral spreading, but when you look at like why children or kids are less affected, it's because they actually are producing more melatonin. So there's a correlation there with melatonin in the immune system. And it actually works as an antioxidant too in some capacity. So melatonin, there's still some mystery around it. It's produced in the pineal gland. That's that same gland that's in the back of your brain that can see the street light across the road even though your eyes are closed. And it's synthesized from tryptophan, so your turkey and that kind of thing, that other slide I was showing you about. Or you can just buy tryptophan off the counter too and do that. There's a lot of cofactors. Going back to the iron and the restless leg, here's like, I'm always trying to pair up. If I can take one thing and kill 2 or 3 birds with one stone, you've got restless leg and you can't sleep well, I'm going to say, I'm going to go, you might need some more iron, try it. Niacin helps with that, folate, zinc, B6, here's your magnesium again, vitamin C to some extent. B6 and 5-HTP basically convert right into melatonin. That's why I have a little asterisk there. So, actually, not that this is terribly important, but here's the synthesis of that. You've got your 5-HTP, your B6, that turns into serotonin. So if I have that patient that has that depression, they have low mood, they can't sleep well, I'm going to encourage them, if they haven't, to try 5-HTP and vitamin B6. Again, attack a couple different health issues just with a few things. And then, again, melatonin's working in the brain to help us sleep and basically, again, in theory, turn off our brain and help us to sleep. It also helps with gut repair and it also helps with the adrenals. So melatonin's doing, so if you have a lot of gut issues, IBS, irritable bowel syndrome, gastritis, acid reflux, and you can't sleep well, that would be that patient that I would say, okay, let's try some melatonin. You have more than just one thing, more than just a sleep issue. You've got a gut issue, or you've got chronic fatigue syndrome, you've got some adrenal issues going on. I've had patients where they've donated a kidney, now they only have one adrenal gland. That's a problem. Let's give that patient some more melatonin and help that adrenal gland respond better. And they get sick a lot, they've been on antibiotics. I've got like 3 or 4 things that are all potentially melatonin deficiency caused. So,
And what do you think about dosing?
That's a good question. I don't think did I talk about dosing? Maybe I did. Well, dosing. So dosing on melatonin is tricky. We can have 100 patients and they all need a different dose. Start out with 1 milligram and go up to 20 potentially. Like I know Dr. Whitcomb sometimes recommends 10 to 20 right off the bat. So it's a huge dose. What did I put on the handout? 0.5 to 3. 0.5 to 3 I would say is like an average, but there are patients that need 10 or 20 to respond. So that's a huge net. And again, nobody has a crystal ball to say this patient's going to respond to 2 milligrams and the next patient's going to be 20. It's just a trial and error. Just start low and just kind of creep up every 3-4 days and see how you respond. Production set by the light and dark. Like I said, your pineal gland is not going to produce that melatonin if it sees the street light across the road. So make sure your room is dark, 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 dark. Largest production is between 11 and 3 a.m. Again, we think, right? So is this a byproduct of sleep or is this helping us sleep? We still, there's a rhythm. We know there's a melatonin rhythm, but we don't know what's causing what potentially still. Overall CNS sedation, I would maybe kind of put a question mark there now. Vasodilation in cardiovascular system, so it helps to lower blood pressure. Our blood pressure is obviously lower at night when we're sleeping. Increases sleep parameters, so that gets you into that deeper sleep. Decreases body temperature. Actually works as an anti-inflammatory, and it's also neuroprotective. So there's just more than, some patients will be recommended melatonin outside of the world of just sleep. They have a poor immune system. That Alzheimer's patient or somebody who's suffering with memory loss, doctor or provider might recommend actually melatonin for different reasons other than just insomnia. So I'm going to kind of think outside the box a little bit. Okay, so here's the dosing, 0.3 to 3. I would even add, potentially up to 20. Generally taking it 30 minutes. Here's something too is a variance. Some patients, they need only 30 minutes and then they're knocked out and going to sleep. Other patients, they might need 2, 3, 4 hours prior to going to bed that they would have to take their melatonin. So you need to play around with that too, potentially. There's all kinds of delivery systems. There's oral, sublingual, slow release. Which one's going to work best for you? Again, part of it's trial and error. The sublingual, like we have this liposomal spray, I personally have used that, and that knocks me out within 10-15 minutes. At times, not all. It doesn't work all the time. And it's like, well, what happened that night, right? I think we've all been there. Or that patient that chronically gets up between 2, 3, 4 o'clock in the morning and can't fall asleep. Yeah, I'm going to recommend the slow release tablet. You're going to take it at bedtime, but it's not going to kick in until 4 hours later. And here's another factor. Melatonin's tricky. Time to benefit, you can have it work that same night you take it, or you could take it for 90 days in a row and then it finally kicks on.
Wow.
So that's where it's like patient comes in a month later and be like, yeah, that melatonin you told me didn't work. I'm going to be like, I'm not surprised, So you got to just have that expectation that melatonin is not the cure-all. So. Adverse effects, like I said, morning sedation. Sometimes melatonin will work for a patient, then they'll come back in and say, now it stopped working. That's what I'm going to tell them. Take that supplement holiday, that melatonin break, and just don't take it for a few days or a while. Some patients will experience kind of crazy dreams. It does decrease seizure threshold. Don't know the exact mechanism behind that, but like we give our kids every now and then melatonin, our little ones. None of them have any seizure issues, but if you know a kid that's, a grandchild, whatever, you just want to be giving melatonin to kids willy-nilly because, they're all hyped up or something, and all of a sudden you have a problem on your hands. So you got to be careful with that. It does decrease body temperature. In theory, if you take enough melatonin, you might get hypothermia. I've never seen that, but it's just theoretical. If you're camping in Alaska or in the Antarctic and you can't sleep because it's 24 hours of light in Alaska, I don't know. I'm trying to think of how that would play out somehow. Anyways, patients who can benefit. I'm going to skip through this, but kind of talked about all that. Okay, so cortisol management. I kind of think of melatonin and cortisol on like the different sides of a teeter-totter. If my cortisol is elevated, my melatonin should be low, and then vice versa. So conditions associated with cortisol dysfunction, there's a whole list here. So depression, anxiety, chronic fatigue, insomnia, fibro. I've seen patients with elevated cortisol levels. You get their cortisol levels back down to a normal level, and their fibromyalgia just magically disappears. Insulin resistance, cardiovascular disease, obesity. We always think of cortisol. Everyone's like, oh, I got too much cortisol, all this belly fat. IBS, infertility. Cortisol can rob our calcium from our bones. Increases our risk for autoimmune disease. Makes PMS worse, hot flashes worse. A lot of patients, again, are coming in here for estrogen therapy, and if you get their cortisol back under control and their stress response under control, their hot flashes can go away. So a lot of patients do come in and and even doctors too, they'll say, well, you don't have enough estrogen. Your hot flashes are getting worse. You must not have enough estrogen. And I would say, well, let's pump the brakes on that. Let's see what their cortisol level is because we've never tested it. And then lo and behold, it's double the normal level. And we give them some cortisol management supplements and they do some stress reduction. They change some things lifestyle-wise and lo and behold, their hot flashes go away. It had nothing to do with estrogen. So it just has to do with cortisol response. When we're stressed, we have too much cortisol. We don't think so good. That's pretty intuitive. Cortisol and hypothyroidism is strongly correlated. So I see that a lot here at this pharmacy where a patient's cortisol levels through the roof and their thyroid medicine isn't working. We're constantly having to adjust thyroid dosing here. And the problem is that cortisol, there is an enzyme that converts your T4 or your synthroid into active thyroid hormone called T3. The problem is if you have too much cortisol, it literally blocks that enzyme from creating that conversion. So if you're stressed, your thyroid medicine isn't working as well as it should. If you get rid of that stress, you pull that stress away, now all of a sudden your thyroid gland or your thyroid medicine can start working the way that it should. So sometimes doctors, and again, it's no fault to anyone really, but you just have to think in a bigger picture that if somebody's thyroid medication isn't working and their numbers are coming back that they're still hypothyroid, we want to ask that question: is your cortisol elevated or not? Because if it is, that's the problem. It's not that the dose is too low; it's that there's something blocking it from working. So, all right. Supporting, this is kind of a little bit kind of digressing here, but if we have a patient with high cortisol levels, they're not sleeping, they have insomnia, we want to make sure that we're doing something to support the adrenal gland. So you want to achieve high cortisol in the morning. You want to make sure that their cortisol is actually spiking in the morning, but then you want to make sure that it's also tapering at night. So you want to test at more than just one time a day. You want to make sure they're following their sleep hygiene, they're getting proper exercise, supplementation. Again, that patient might, if they have high cortisol, they would most likely benefit from 5-HTP and from vitamin B6. And then there's all kinds of adrenal builders out there. I won't get into that. That's another talk for another day. Patient comes in, they do the cortisol test because they're not sleeping well. Ashwagandha, L-theanine, phosphatidylserine is great. Phosphatidylserine, so cortisol stimulating the brain at night, the patient can't sleep. You give them phosphatidylserine, and that blocks the cortisol from stimulating their brain at night. I love using that product. We sell a whole different types of it. PS100 is over there. There's a couple of different combination products in the adrenals line. So I definitely like using that. I've seen that to be very beneficial. The caution with this, though, is you don't want to snow that patient. You don't want to give them too much, where then their cortisol never gets that spike in the morning to get them up in the day. So you can kind of see some of this where it crosses over in the morning and can be problematic. So we do recommend a 4-point cortisol test for that patient that is just that wired and tired all the time at night, and they just can't shut their mind off. I'm going to have them do a cortisol test and see what's going on throughout that entire day. Because if their cortisol is mucked up, good luck giving them melatonin and all these other things. If their cortisol is elevated and screwed up, they're not going to sleep well in general. So we could be guessing all day long.
And is the cortisol test still the saliva 4 times a day?
Yep, it is. Yep, it's a spit test. Just spit in the tube, send that out. In about 2 weeks, we're going to know what your cortisol level's doing. Yep. Sleep so I'm kind of changing gears here. Actually, I'm going to reset my camera again. All right. So if you have the intention of leaving with a sleep aid tonight, this would be the one I'd recommend because it covers all the bases. So it increases. So there's another teeter-totter that I like to think of. There's melatonin and cortisol, and those are on balancing on a teeter-totter. And then there's GABA and glutamate. GABA is the brake system of the brain, and glutamate is the gas pedal of the brain. And so there's obviously certain times throughout the day that I want one on and one off. But at night, I want my GABA actually elevated, because GABA is slowing stuff down, slowing my brain down so I can think and process and fall asleep. It increases melatonin production. It decreases time needed to fall asleep, reduces the negative impact on cortisol at night. So there's product in there to help lower cortisol. Reduces muscle tension, basically there's some reactive magnesium in that product. It's been shown to prolong REM sleep, so we're getting longer, better sleep cycles essentially. The hard part with Serenity PM is the dosing. It's tricky. I have some patients that will respond to 1 capsule, and then I have some patients that need 4 capsules. Again, so, and then timing is a little bit different too. Generally speaking, it's about 1 to 2 hours before bedtime. With Serenity PM, unlike melatonin, some patients, they'll just take it 5 or 10 minutes before they go to bed and they're good to go. That's the easy case. If that doesn't work and they end up coming back and they need Serenity PM, because at that point I'm at a loss of what do we do with this patient? And then we don't have time to wait 2 weeks for a cortisol test to come back. They could go home, take the Serenity PM, but I don't know if that patient's going to need 1 capsule, if they're going to need 4, and if they're going to need to take it an hour before they need to go to bed or 2 hours before they need to go to bed. So it gets really tricky with this one too. But again, it does mechanistically cover a lot of the different potential bases that need to be covered. So it's a good catch-all. But again, it's hard to dose it out exactly for each patient. So it's a little bit of trial and error. So, Other sleep support supplements, again, we talked about progesterone, but again, it's got to be oral progesterone, and it can't be the synthetic progesterone. You can buy GABA, which somewhere over here. Well, maybe not. Maybe we sold out of it. I don't know. Usually it was like right here. But you can just buy GABA by itself. It's a great calming neurotransmitter. Tryptophan, 5-HTP. Again, that's going to convert into melatonin with vitamin B6. Now I'm going to contradict myself. I said sometimes I take my B vitamins at night. So in general, B vitamins should be taken in the morning. But there could be that case where you might have a benefit of taking them in the evening. Detox supplements. So that seems kind of odd, but again, when we're sleeping, our liver is at full function, cleaning everything up with our lymphatic tissue. Somebody raised their hand about getting up in the middle of the night. Yeah, if you are waking up consistently at, let's say, 2 o'clock, 3 o'clock, or 4 o'clock in the morning, I will almost guarantee you that you have some level of liver congestion. And so you want to take milk, I mean, again, I don't have that crystal ball yet. I'm working on it. I would take milk thistle throughout the day, like 3 or 4 times a day. Or with each meal, take a capsule of milk thistle. And that's going to allow your liver to be better equipped during the night to do all of the processing that it needs to do to kind of clean up all the garbage. Doesn't always work, but I think we sell milk thistle for maybe $30 or $40 for the bottle for a month. It's worth a try, in my opinion.
You say it comes in a bottle?
Or capsule. Oh yeah, it's a capsule.
You just put it in water?
You just swallow it. I would take one capsule with probably each meal. Yeah, it's a nice little trick. This is 120 capsules for $50, but there's a smaller bottle over there for probably 25. So that's, again, a neat trick that you wouldn't think, like, clean my liver throughout the day to sleep better at night. But I've seen it work more than once. Again, it doesn't work every single time, but again, if that's you, certainly try that. I'm a huge fan of, not so much calcium, but magnesium. I can't say that enough. Like magnesium, again, the right type of magnesium, the right amount of magnesium, the right time of day, I've seen that to be very beneficial. Omega-3s, not so much. I would probably put that towards the end of my list. Valerian root, I have limited success with that, but again, it's something that's potentially worth trying. So again, set that evening ritual for yourself. I know I found that important even just for my own self. Just, I try to burn the candle at both ends, and that just never works. Decide when you want to get up and set that clock 7 to 8 hours ahead of time. I think that's just intuitive, but I would have to tell myself, okay, I'm going to get up at 6 o'clock. I need to be in bed by 10 o'clock. Surrender to sleep, meaning, let go of being awake. We're just constantly thinking of all that stuff that's in our brain. Just let go of that. And again, this is the Dr. Chatterjee, to start tomorrow, we need to stop today. You just cut off today, leave it there, and then sleep is, like I said, sleep is just as important as food to survive. So we need to start thinking of it that way. Well, I hope you enjoyed tonight's seminar and learned a few things about getting a better night's rest. If you have any questions for me, you can call me at the pharmacy. I'm at 262-373-1050. I'm typically here Monday through Friday, 9:30 till 6. I do one-on-one appointments, and I charge $100 for those, and I can set up a specific plan for you, be it sleep or any other health issue that you may have. And I look forward to seeing you next time. Thank you.